Almost 4 years ago now, I moved to Fairbanks, Alaska to start veterinary school. I went in with the career goal of improving access to veterinary care in Indigenous communities. In college, I volunteered with organizations offering free veterinary services at the local homeless shelter and with the organization Rural Area Veterinary Services on Native American reservations. There, I saw people lining up at 5 a.m. after driving for 2 hours just to have their animals seen, and saw diseases that are exceedingly rare in most of the country. In Alaska, I worked on a project gathering data on access to care in a rural region, the Yukon-Kuskokwim Delta. This program, the Bethel Hub Outreach Project, is run jointly by Colorado State University College of Veterinary Medicine and Biomedical Sciences and University of Alaska Fairbanks Center for One Health Research. The program aims to provide a model of how consistent veterinary care in a specific rural region can improve animal and human health. We recognize that the lands on which we do our work are the unceded ancestral lands of the Yupik people who have stewarded these lands for thousands of years and continue to today. We respect the Yupik people's enduring relationship with their homelands and are grateful for their partnership. This May, I will graduate and return to Fairbanks, so I'm up here speaking to you not as an authority on these complex challenges, and not to speak for the communities I've been able to work with, but to show you why I think this work is needed and why I want to spend my career working towards solutions. The most recent trip I've been on was this past July with the Bethel Hub Outreach Project and the overseeing veterinarian, Dr. Lori May Thaler-Mullins. From Anchorage, we flew to Bethel and then took a 45-minute riverboat trip to Napaskiak. We were immediately greeted by kids swimming and friendly village dogs wandering over. On trips, we offer free spay-neuter surgeries to prevent reproduction, vaccinate against common infectious diseases, and deworm for parasites. This community is within the region the program has been focused for the past 4 years, yet local community members report this is the first time in at least the past 10 years, if ever, that a vet team had come through. Access to care in the region is so limited, it could potentially take quite a few more years for all of the villages to host clinics. This phrase, access to care, is a big buzzword right now in veterinary medicine, especially as we find ourselves in the wake of new COVID pets in combination with a nationwide veterinary shortage. I'm sure some of you have felt the effects of this through long waits at an emergency clinic or struggling to get your pet an appointment. Access to care can be defined as many things, but it always touches on 3 main topics: geography, finances, and communication. Geographic restrictions can look like a 5-hour drive to the nearest vet in the contiguous United States, or in Alaska, an hour-long plane ride just to get to the road system. Financial barriers exist everywhere, but become more prominent in marginalized communities. Communication is how well we, as veterinarians, are able to translate medical information and come up with a plan that's feasible for a client or community and patient. In the context of working with Native communities, communication involves building trust in the face of a long history of negative consequences to working with outsiders, including scientists. These factors all become compounded in rural Alaska. Alaska is the largest state. If you were to overlay Texas, it would only cover 40% of Alaska's landmass. Yet Texas has 20 times the road mileage that Alaska does. A huge portion of the state is inaccessible by driving. The populated areas outside of the road system are commonly referred to as villages and are primarily indigenous communities. Villages can be accessed by plane year-round, dog team and snow machine in the winter, and riverboat in the summer. Some hub villages, like Bethel, have a few thousand people, but many have fewer than 100 residents. In these remote communities, we see a unique interface of wildlife, pets, and people. Many people live a traditional subsistence lifestyle, meaning they're hunting, fishing, and gathering a large portion of their diet. Store-bought foods are available, but at a highly increased price, like $9 for a box of Cheez-Its, $13 for a gallon of milk. And dogs usually live outside, increasing contact with wildlife, and as a result, increasing the risk of disease transmission. In addition to dogs living outside, we also see overpopulation, a challenge that's not unique to Alaska, but the underlying cause is. 100 years ago, dog teams were the primary mode of transportation. With an increase in popularity of snow machines and many other societal changes, dogs became concentrated in communities, and with a lack of veterinary care, the problem persisted. The remoteness of these communities also allows us to get pretty creative with packing. All of the supplies we need are loaded into about 6 plastic totes and put onto a plane or boat. Even with all of our planning and carefully chosen medical protocols, there's a really good chance we'll run into conditions that we can't treat or have to treat in ways that aren't totally textbook. And above medical knowledge and surgical ability, flexibility is an essential component to building a team for a field clinic. Things like a bad winter storm, good weather for salmon fishing, or a death in the community are all reasons that a trip could be canceled or have a really low turnout. Patient numbers are also really dependent on having an existing relationship. If this is our first time in a new community, people could be understandably very hesitant to have their animals undergo surgery, or might just be confused as to what our role is. And that's exactly what happened on our trip in July. We were planning on doing surgeries and staying at the local bingo hall, which is actually a pretty common place for us to set up. When we got there that afternoon, the woman working had not been told we would be coming, but she was nice enough to give us a corner to set up in, with the caveat that bingo would still be going on as planned that evening. We appreciate any accommodations that are donated, but luckily within a few hours, we'd been offered to stay at the local human medical clinic and had people willing to drive our gear around. Trips would not be possible without immense community support, and kids are always happy to help too, things like pulling the boat in, directing us through town, and introducing us to their animals. On this trip, we had one boy bike up to us and ask us if we were the new teachers, which is totally fair, most white women there are. He then told us we all looked the same, which is also fair, and then declared he'd be following us around for the day. We love having kids involved. Small things like listening to heartbeats through a stethoscope or giving talks at local schools can help create empowered pet owners and might even spark an interest in veterinary medicine. Children are also a key reason why this work is so important from a public health aspect. Native Alaskan children currently have the highest reported dog bite rate in the country. Aside from injury, this is a serious problem because of the rabies virus. Rabies is spread among animals and humans through saliva. The disease progresses to affect the brain, and it always leads to death, sometimes in as little as 1 to 2 weeks. There is no treatment for rabies, but prevention is possible through vaccination. It's important to consider the impacts of a rabies outbreak in a village. An infected fox comes into town. These are the most common carrier of rabies in the state. There are loose, likely unvaccinated dogs able to come into contact with the fox. And when there are possibly infected dogs wandering through town, people become afraid of interacting with their own pets, and in some cases scared of going outside. And when there's no veterinary response, community members have to begin to make the incredibly hard decision of what to do with infected animals to stop the spread of the disease. I know of 2 scenarios that have played out similarly in the past 2 years. This poses a challenge, as the World Health Organization has committed to 0 human rabies deaths from dog bites by the year 2030. Luckily, a human death from rabies hasn't occurred in Alaska since the 1940s, but for rural coastal communities, the risk is very real. So, I am now at the jumping off point in my career where I get to take everything I've learned about field medicine and the understanding I have of the importance of traditional knowledge and contribute to the efforts to improve access to veterinary care. As a new graduate who will finally have the opportunity to be in one place for more than just a few years, an area I'm really excited about is community partnership. As I mentioned earlier, historically, a lot of community health decisions and research have been done without input from tribal members. When we make these decisions with solely a Western approach, not only are we further erasing Indigenous knowledge, but we're setting ourselves up for failure long term. The enduring relationship between Mike Williams Sr. and the veterinarians who run the Bethel Hub Outreach Project is an example I'll carry with me into my own work. Mike Williams Sr. is the current Akiak tribal chief. He's a mental health counselor and a lifelong dog musher. He's been involved with the program since the beginning, introducing it to other local community leaders and advocating for resources in his own community. he continues to fight for the inclusion of public health veterinary care federally within Indian Health Services. As I mentioned earlier, currently, the vast majority of veterinary care in Native Alaskan communities is provided through nonprofit organizations and funded through grants and donors. Inconsistent funding means inconsistent care, which negatively impacts building trusting, long-lasting relationships. Inconsistent care also impedes preventative measures such as vaccinations. There are amazing programs such as Alaska Native Rural Veterinary Incorporated, who's visited over 90 villages since they started 10 years ago, with the commitment to returning to villages, many on a yearly basis, and the Bethel Hub Outreach Project using this hub and spoke model to provide consistent care in a specific region. And steps are being taken to prioritize this work. This past November, the Alaska Federation of Natives, the largest statewide Native organization, adopted a resolution requesting funding for veterinary care from Indian Health Services. The resolution calls for national recognition that the lack of veterinary care in Native Alaskan communities is a public health crisis and should be regarded as such. Progress is being made as access to care organizations and partnering communities advocate for resources, but there's still so much to do. Understandably, Alaska may seem removed from your daily lives, but I encourage you to recognize the many indigenous communities in the United States, some only a few hours away, who are dealing with similar challenges, and groups locally experiencing barriers to care, such as those experiencing homelessness. Large systemic changes are needed for consistent access to care, but small acts like donating dog food, blankets, and collars, and your time will always be impactful for animals and their owners. Thank you.